Hi, good afternoon, everyone. Thank you for attending our another monthly Ask Charlie Anything awareness talk. Okay, so before I start, let me introduce a bit about Mind Story. So, okay, in Mind Story, we provide services to those children who experience academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Okay, in Mind Story, our team consists of therapists or professional health professionals from different background. So we have academic support, which is special needs teacher. We have a behavior therapist, clinical psychologist for diagnosis, counseling and guidance for parents, occupational therapists, reading therapists, as well as physiotherapists. Okay, you can contact us at this number or email us if you have any questions about special needs or if you want to know more about Mind Story. Our operating hours is Monday to Fridays, 8 a.m. to 5 p.m. We also open on Saturdays, Sundays via prior appointment only, and we are closed during the public holiday. You can also check us out at Facebook at mindstory.mind to check out our monthly awareness or workshop talks from different professionals that are contributing to the Society of Children with Special Needs. You can check out our website at mindstory.com.my. You can check out our Instagram at mindstory.my, as well as our LinkedIn, Mindstory, Pusat Pelatihan Kanak-Kanak Berkebutuhan Khas. Okay, so today we are going to talk about social interaction. Okay, based on my experience working recently we have a number of concerns regarding social interaction among children, especially to those who are going back to school or just about to start to go to school. We have a special case today, our in-house occupational therapist, to share a bit about her point of view on social interaction through play. So here I'm going to welcome Miss Alia, our own in-house occupational therapist. Hi, Alia.
Hi, Charlie.
Hi. Okay. So today our topic is about social interaction to play.
Yep.
So there are some questions that I would like to go through with you and to understand more because I'm not from occupational therapy background, so sometimes I too have difficulty understanding, like, you know, when we talk about social interaction. Okay, like we can see a lot of children. We talk about like okay, what we do in terms of social interaction, and then recently we have the pandemic. You know, where the childrens are, you know, they are not exposed or they have this distant learning. Okay, and then they are preparing for school, and then when they arrive at school, they have difficulty adapting, and then they have feedback from the school as well, saying that, you know, the child is not interacting with others. Okay, and then the reason why I invited Miss Alia to share is also because as an occupational therapist, they have a way to provide suggestion on how to promote social interaction. Okay, so Miss Alia, so okay, let's start. Okay, so what is social interaction in terms of occupational therapist point of view?
Alright, so actually a social interaction is one of the social skills that a child required to perform every day. Because social skills are the skill that we use every day. We need to use to interact and also communicate with other peoples. And for the social skill, we have a different types of social skill, which is we have verbal skills and verbal communication and non-verbal communication. So like the verbal communication, like what we usually use, which is how we interact, how we talk with the peoples. And for non-verbal communication, it's more like a physical gesture or body gesture. So we have the different types of social skills that usually a child required to interact with parents, with friends or other peoples.
Okay, so another question. Some of the parents ask me, when we talk about social interaction, some will ask, why occupational therapists? Like what, why occupational
Why
therapists?
OT do social skills?
Yes, yes.
Yeah, because actually as an OT, which is we are occupational therapists, which is we more focus for the occupation. We more focus on the occupation. So that's mean social is one of the occupation that we require to do every day. So it's like every day, like how we do feeding, how we do bathing, and so on. So social is like one of the vital or one of the important activity we need to do every day. So that's why OT need to cover for the social part.
Okay, so if we put in this context, meaning that one of the child's occupation, other than do activity, daily living, like you said, eating, cleaning, going to school. So one of the occupation is social, to practice social interaction.
Correct.
Okay.
So social, because social interaction, a child or as an adult also we required to interact with others. So we need a communication with people. Sometimes maybe we need to communication to get or to get this solving the problem or to have what apa yang kita ada dalam fikiran kita lah, itu yang kita perlukan communication with the others.
Okay, so it's important for a way for the child to interact with the environment, also people around them. So yeah, it's thanks for sharing. It's a new thing for me.
And also I want to share like if a child able to do communication, so they can know how to express their feeling, their emotion, and they know how to use a physical, how to appearkan dia punya physical expression when they're happy, when they're sad, so they know how to have empathy with other people. So through the social skill, they can able to have social interaction with the others people.
Okay, all right. So for those who join us, it's something that I learn on a daily basis as well. You know, thanks to Miss Alia that share with us, because you know, we always here's the term of occupational therapy, but we don't really understand, you know, what occupation. So when it comes to children, from Miss Alia sharing, one of the occupation is to social interact, one of the component in the occupation for a child. All right, thank you for sharing that information. Next, I have a lot. I have come across a lot of questions like this as well, where parents ask, is social interaction important?
Actually, social interaction is important because when a child want to go play with the other peers, they need to interact. Otherwise, how they want to play? Is it they play with the machine? Of course not, right? So they need to interact with other people. So that's why social interaction is one of the important things in a child development. Otherwise, he maybe can have a delay in speech or language development, or maybe have a delay in a certain area. So it will interrupt the performance or the development of the child. So that's why social is important for the child.
Okay. So social interaction is also important for the development of a child. So can I know which part of the development?
It's the development in a speech and language, as well as the ADL performance, which is like when a baby or when a child at like 3 years old, they should know how to dress or undress their shirts, their pants, and how they need to know when they need to go toilet. So social is one of the ADL functions. So it's one of the daily living activity that they require to perform every day. So that's why if a child apa ni, delay in development of social, it will affect their performance, especially when they go to school, so they don't know how to interact with their children, with their friends, or they do not know how to express their feeling, and sometimes they maybe become tantrum or screaming in the class because they do not know how to express the feeling, their emotion and so on.
Okay, I see. So in terms of development, like speech and language, social interaction also can help in terms of ADL, activity, daily living skills, and also like um, uh, to help in terms of school, like, you know, if the child not feeling.
Independency for them in school.
Okay, and then when so it's like, you know, when they have difficulty, they don't know how to do how to do a task that given by the teacher, then they can interact, they can ask the friend. So let's say if they don't know how to interact, they don't know how to work with the friends, then they are unable to, you know, finish homework or things like that.
Yeah, that's why the social skill required for them, especially when to help them develop their confidence level, their self-esteem, because without the social skills, then how they want to develop the confidence to ask teacher, to ask their friends how to perform the task. So it's difficult for them to do that because they do not know how to express and how to respond to the situation.
Okay, it's like problem solving.
Correct.
And then also problem solving, build up of their self-esteem, like also to initiate tasks, to work in a group with other children.
Yes.
Okay, so this is the part where like participation in school. So so if they cannot participate, and then the school will find it difficult, you know, for them, and they will find school very difficult for them.
Yeah,
and then also another part,
they will become tantrum or don't want to go to school because they do not know how to interact lah.
And also it relate. You also mentioned that, Miss Alia, that it affect their social emotional. So when they feel frustrated, angry, sad, that's where they have difficulty telling, and then they change to, I mean, they show, they present some difficult behaviors, like crying, tantrums. So it affect their school performance lah.
Yes.
Okay. All right. So those are the importance from Mr. Alia of why social interaction is important for a child. Okay. The next question is, okay, how does social interaction impact on a child's development? I believe we already briefly talked about it. Okay.
Yeah. Actually, it's a lot of impact for a child when their social interaction is poor, because when the child have difficulty to interact or to have a good social interaction with their friends, so they maybe have developed some of behavior. Like example, they may be tantrum, or maybe they will yelling in the class, or refuse with some of the activities. So it's one of the impact of why the development of social skill is important for the child. Other than that, they maybe have difficulty to have good eye contact with the person, because when we do communication or we do the interaction with other people, we will see we will have the eye contact. So can help the child more confident to express and to respond with in their conversation. And also sometimes the social interaction will impact the child's development. The child will be struggle to using appropriate body language, to use appropriate question, and sometimes maybe they do not know how to express. So is this why social skill is important for the child. And sometimes we can see a child have difficulty to start and ending the conversation. So it's one of the impact for the child, because when we do a conversation, we have a starting point, we have the body of the conversation, and we also have the ending of the conversation. So they do not know how to plan So that's why they have difficulty to interact with the other people. And if they do refuse to do the interaction, they tends to play alone.
Mhm.
So that's why it's important to have a social skill for a child. And also sometimes we can see the child will talk with unusual speed, or maybe have a stress in their speed or their conversation. And sometimes we can see the different tones of voice, because they do not know how to interact. So they will be apa ni, akan ada perubahan dalam dia punya conversation tu lah.
Okay. So in terms of development at school,
Yeah.
development of speech, development of social skills, these are very important component if the child going to school. So I think one of the example I can relate to this is when the school feedback about the child way.
Yes, how
They cannot share toys.
Yes.
Yes, they cannot share toys with others, and the body language or the way they talk, it looks like they are interrupting the teacher talking. They, inside the class, when they want to say something, they don't raise their hand, they immediately.
Yep.
So
immediately campur dalam conversation, so they do not
Ah.
know how to do that, how to plan that things of conversation tu lah. So they do not get the apa ni, tak dapat dia punya input dia macam mana.
So when they don't get the input, they are not able to interpret, or they are not, or they are not able to be aware of how a person. So let's say without raising hand or say excuse me, it sounds rude by the teacher, like, oh, this kid never said excuse me or thank you, very rude. Maybe because,
so the
like
teacher will complain something else, then will be the child become demotivated or whatever. So that's why social skill is important, especially when a child that born in this COVID time, so they do not have a lot of exposure with the other children. So they do not know how to interact, how to initiate to do the conversation, to play along. Sometimes when they play turn taking activity also, they do not know how to do, how to understand the concept. So that's why they become difficult to perform, to play with other children.
Okay, so when the social skills or social interact is underdeveloped, then it will impact the development of social skills, which also will impact on the daily living of a child. Okay, so a lot of feedback we have from school saying, this child is not cooperating, tak boleh kerjasama dengan budak lain, like, cannot cooperate, do not listen to instruction.
I cannot understand the rules of the games or whatsoever like that.
And then when they request for something, they cannot request properly, and then they if they don't get what they want, they will start crying
and weaning and so on.
And then also one thing that you share, which is social emotional, where if they cannot participate, or their social interaction or social skills are underdeveloped or not developed properly according to their age, that's where they have low self-esteem. They don't want to join with other kids. They become like what we always hear, antisocial
things. Because they're more interaction with the machine, with the gadget, so it's difficult for them to understand the feeling, understand the emotion. So it's like lack of empathy. It's difficult for them to understand the concept, why the child sad, or why the child, how to be happy. So it's difficult for them because they do not know the expression, their feelings, because use a lot of gadget things lah.
So why is that child crying? They don't understand. Or why do I need to share my toys?
Correct.
And also, so when they don't have the skill to start or end the conversation, then their self-esteem become low. Then they will not participate in social group. They play alone, like you share. Then it becomes very quiet. They don't want to interact. They don't want to cooperate. They don't want to work. So in terms of development, child has different cognitive development, physical development, all this. Yeah. So yeah, so it's a good sharing from you, Miss Alia, because all this while we have some parents also asking, why they always talk about social interaction or social
Yes,
skills.
because usually people do not know why social is important, why they need a social. Because actually when we do, it's like social is like one of apa ni, we take a granted. Because we can talk, we can have a conversation, but it's not like a normal conversation if we see properly lah. For the child that do not have a good social skill, is not apa ni, macam satu conversation yang tak sepatutnya berlaku. Mungkin have inappropriate language, inappropriate response or something like not answer the question. Sometimes also can be one of the social skill problems for a child.
That's a good point. We can see this after the pandemic. A child can be very good in communicating, but that doesn't mean they can socially interact with others. They can tell you a lot. They can tell you story fluently in different languages. But when you put it with another child, same age, he or she unable to interact
together because it's a different, like maybe have a different feelings, make different body language or gesture, so it's difficult for them to interact together.
So in context of children with special needs or disability, to parents and teachers or everyone that joined us today, this is one of the reasons Ms. Alia have shared. Even with normal kids, OT will try to push social interaction, because you can see, like she's shared, a lot in terms of development. It's a lot. It looks small. It's like very small, but it's important because it can impact different kind of development from psychological, emotion, behavior, and language skills, cognitive skills, all these problem solving, all this evolve in social interaction. So that's why when we talk about in specific children with special needs or disability, you can see that by OT also talk a lot about social interaction, because it does contribute to a child's development. Because like what Ms. Alia also said, sometimes we overlook, we focus on other things like the child's academic, the child's behavior, but we sometimes forget about social interaction. Okay, so the next one. How do children develop social interaction skills or social skills?
Okay, so how to develop is through play, because children occupation is play. So how to develop is through play lah. So like example, we do role play, we do a singing activity or anything kinds of the activity, but that require conversation. So we can help them to develop a better social skill performance. So other than that, we also see what types of play that they usually use. Is it unoccupied play, solitary play, or parallel play, or maybe associative or social play? So usually in the social skill, we will see the child able to participate in social play, because social play, they require turns taking, required to solve a problem, judgment, and also some of decision making they need to do. So it's required what is it called? Complex, it's more complex performance compared to we just do unoccupied play, which is like the infant play. They will see the thing and do not know how to play the toys. So it's not like that. For social, it's more complex for a child. So that's why sometimes we can see a child is able to perform fine motor skill activity, gross motor, but maybe they have difficulty to perform social skill, because it have underlying issue, maybe like
Mm.
sensory hypersensitive, or maybe it have psychological issue like low self-confidence, low self-esteem, lack of confidence level. So it's important for the child to play along with their peers, that the friends that have a same age or same level of performance or IQ performance, so they can help them to more confident to play with them. So so what we can do is we follow their interests, and then parents can follow their interests lah. Then we can learn with our children to ask a question, so we know how to make a conversation between asking question and answering the question.
Yeah.
And also we can practice role play activity or pretend play, so a lot of activity that can help the child to develop their social skill performance.
Yeah. Okay. So yeah, for this one, I also hear a lot from parents. Like after the therapy, they're like, what is the OT doing? Why is she playing only? Every time I send to therapy, I see the OT play the blocks, play Lego, and then
Or sometimes just plays plasticine, like a plastic, what it actually is.
yeah, coloring, and then they play hide and seek, and then they run here, run there, changing. So for parents out there or teachers or anyone who experience OT, so according to Miss Alia, the occupation of a child, other than going to school, they also play. Okay, hence that's why they put their social interaction through play. So they learn not only in the academic setting, but also when they playing, they do learn as well.
Yep.
So for parents that are curious, like why OT play, I send to therapy. What it's not, I send my child to play. If I want my child to play, I can go playground. So it's very different. I believe it's called a guided play. You know, the OT occupational therapist will guide your child and then engage. So through play, I think they also build rapport, right? So you get closer to the child and then they can work. And then based on the child's interest, you slowly explore. Okay, so parents, for those, now you know why at the age, like especially children with special needs, sometimes you do need a little bit more of playing. Sometimes, maybe, just maybe, they don't know the function of playing. Yeah.
Yep.
So they haven't have the skill of learn how to play. So by playing with, by through playing, they can learn about social skills.
Yeah.
Okay.
Because
Thank you.
play also can help the child to explore their world, so they can know how the texture, how to feel this thing, how to get the concept of the activity. So that's why a child required a lot of play, because play is one of the occupation for them.
Okay. So it's like adult. Your occupation is
going
to work. But other than that, yeah. So this is the thing I also learned from OT. You can see a lot of OT. Only recently, I mean, all this while, a lot of OT, like Miss Alia, working with children. But if you're familiar with hospital or working around hospital or nursing home, you can see OT help a lot of people with stroke or after accident, after operation, or after some injury, they'll refer to OT. So this is where I learned from Miss Alia also. This is where OT help them to get back to their occupation.
Correct.
So those who have stroke, like, patah kaki, patah tangan, after that, you have operation in when healing, this is where OT help you to get back.
The healing process, OT will help to get back.
So I believe it's the same concept, right? So you help the child, if like social interaction, in order for you to help the child to get back to play or to get back to social interaction, you do it through play.
Yes, because one more thing, because when a child go to school, it's like one of a complex area for the child. So that's why sometimes we can see the child will refuse to go to school, don't want to go to school, or maybe have a little bit behavior that's a different situation, like example, in home, he looked good, looked nice, but when we send them to school, it will become different character for them.
Yeah.
Because school is a complex area for a child.
Okay. So at home, it's not so complex, like instruction is short,
Correct.
clear,
Yes.
expectation is low. So at home, okay,
Okay,
je,
yeah.
can follow instruction. But when go to school, teachers say different, or your child is different. So
Correct.
sometimes parents won't confuse, like, hey, how come? I thought at home he can listen to me, why at school? So, okay, so this is
Yeah,
to help
because
them.
of the social.
And then a lot of demand in the social setting.
Yes,
Home setting is a bit control, right? You can control.
correct.
But at school, the child has no control, like cannot suka-suka on TV, off TV macam tu, cannot off the light suddenly,
Yeah.
and suddenly cannot singing macam tu. So, okay, so this is where it means by it's more complex setting. So children who doesn't have or underdeveloped social skills, they will struggle.
Yeah, they will be struggled a lot in the conversation, in performing functional tasks in school. That's why the social and also OT will tend to provide for their children like to screen a lot of small things that we do not notice, like example the social things, how they can perform fine motor skills and so on. So that's why it's important for the child. Actually, this problem or this issue is not only happen for a normal for a special kid, but it also happen in a normal kids, because nowadays bukan nak salahkan lah, but actually we can see more parents will be give a gadget for the children, so a lot of their time not have any conversation with the parents. So that's why it's become difficult for them to understand the concept of conversation or appropriate conversation. So that's why they tend to become yelling in the school, or sometimes screaming, or sometimes they just refuse with the teacher request, something like that can be happen because they do not know how to interact properly.
Yeah, that's a very good point. Yeah. Especially now after COVID, like they cannot go out. So, and then our technology now is so advanced. Basically, you can access to internet from any kind of devices. Okay. Also, next one, which is related. It's just now you did mention about play, different type of play, like parallel play, like
social play.
Yeah, what is this in terms of, because for me and I believe other parents or teachers, we are not OT, so we don't know what is like a functional play. What is a functional play? What parallel play, and then I heard you said.
Yeah. Actually, we have 6 stages of the play that has been outlined by Margaret, which is in 1933, like that. Then they developed 6 stages, which is the first one, unoccupied play, which is more on the infant or the baby will do, which is they just engage in a random movement. Like example, they just pick a toy and then do not know how to play, just pick and go or whatsoever. And then we have a solitary play, which is this one, the child start to play by themselves. Like example, they just take rattle, then they just play rattle for themselves, not have any interaction with other people, or maybe the child just take a certain things, certain toys and just play alone. Okay, and then we have onlooker play, which is this one for the higher level a bit, which is like maybe 3 to 4 years old. They will look on their peers how to perform the task, how to perform the activity. Then they will be copy the games or the activity with other children, or maybe just play alone, but they will be copy macam tu lah. And then we have parallel play, which is this one is more the child start to play side by side with other children without any interaction. So that's mean the child will be play toys, like example they play they play with the colors. They will play side by side, but no interaction at all. Okay, and then the fifth stages is associative play. At this point, the child will be start the interaction, but it's not a lot. It's called like associated activity. We play with other children. They start to asking question and talking about the toys. Just only like simple thing lah macam tu. And the last stages is a social play, which is this one, the child will be have more socialization or more conversation with with their peers, and they will share their ideas how to play, how to cheat with the games or the rules or whatsoever. So they know how to play with the activities.
Wow.
Yeah.
So for those who join us, or also for those who are not OT like me, when we hear play, we thought, oh, I can, make baby sound with a younger child, but actually it's not as simple as that. So
because we need to see at what age of the child should have the stages of the play. Like example, maybe when we get when we get a student like age 1 to 2 years, okay, so we know they maybe will play solitary or onlooker play only, but they will not play the social play because it's more higher function for them.
So all these stages of play, it's age related, is it?
Yeah,
So,
it's related.
Okay,
Because
so
it like a development for a child, play development for a child.
yeah,
Like
okay.
baby will be unoccupied, then we go to the next level.
So if I send my child for social interaction training with OT, so this is where OT can see at what level is my child. So let's say my child supposed to be at social play.
Yep.
But at the moment,
they just play alone. So that's
solitary play.
Solitary play. So
or
we
on
have
loop.
like another 4 stages. Like
So and then or maybe it's onlookers play, just not joining but just there. So
just
from there,
copying the tiles lah.
so from there I can see that according to these stages of play, my child is 3 stages away from the when my child supposed to be in here, but the gap is here.
Gap is here. So that's why sometimes the child have difficulty to perform the social skills, the conversation with their parents.
So
because they delay for the play.
Okay. That's a very interesting sharing. So from there, I can know why is my child behaving not like this.
Yep.
It's here. So from here, then this is where OT will come in and then teach the child so that they can close the gap closer or similar.
So that's why we will use a lot of conversation. Sometimes what we want to do to get their interest, we tend to ask what are their favorite thing, what are their favorite movie, favorite cartoon, or favorite toys. So from there we can do a lot of conversation. So we can get their trust to develop more conversation with us. So that's why we can see which area they will, which stages that they have been through for their development.
Because sometimes I do see when they see a pediatrician or in specific developmental pediatrician, sometimes they have this section where they talk about social interaction. So when the child unable, so this is where they will refer to OT. So now I understand. And then especially when, from birth or 0 or for 12 months until 60 months or 1 year old until 5 years old, there's a stages lah. So from there we can, as someone who don't know anything about OT, so we can learn from the stages that, why is my child antisocial? Because the stages here is missing. So one component is missing, so it affects other development of the child. So we can see that because sometimes doctors also they have this scale where social interaction 60 months or let's say 5 years old, and then they have this component whereby they can see how far a gap. So OT as well. Now I understand. So parents, don't freak out when you see or when you send your child to OT and then you see them playing, especially child 0 to 5 years old or 12 to 5 years old or 1 year to 5 years old. If you're curious, I think you can ask the OT, right?
Correct, can. Because OT will provide the information so we can share why the child become like this or what is the stages now. So that's why it's important for us to check our children development, because sometimes we not notice why when we send to school, teachers tell us like this, like this, like this. So maybe something missing for them that we not notice.
Yeah. Also, like what Miss Alia have shared just now, the reason why a lot of interaction is through play is because it's one of the occupation of a child, and also they like to play, and then that's how they can learn something through play, not only from books or internet, but one of the occupation is to get back into that occupation is also play.
Yep.
Okay. All right. So it relates to the next question where like some parents, like you shared, like role play. So how actually some of the play, like you, Miss Alia, you shared, role play can help in social interaction?
Yeah, actually from the role play, they can know how to ask the question, then know how to respond to the question. Yeah, so they can get they can explore their feelings, they can increase their confidence levels. So from that, they can have a lot of conversation and know how to plan what is the starting of the conversation, what is the body, and also what is the ending of the conversation. So that's why role play is one of the activity that looks simple, but it is important for a child, because child can know, okay, in this situation what they need to do, so they can have they can develop their judgment, decision making, and also problem solving. It's important for the child and also for parents to practice role play activity or sometimes pretend play, so they know, because this activity actually is not only focused on the social. It will be in OT perspective, we will see that role play or pretend play is will help the child to improve their cognitive function, their physical performance, as well as the social performance.
Okay, so everyone that joined us today, so like me also, sometimes I'm curious, what can they learn from play? So the play is very different from how we in general population think about play. It's not like I give you toys, I sit here and you go play lah. So it's not like that. It's not like that. So according to Miss Alia, is interaction. Like when you play, you talk to the child. So you play together, not play along, side by side. Is you play with the child. Okay. Now, and then from there only I know. Okay. So when you play, like you shared just now, so when you play with the child, so you talk to them, and then they can learn how to respond to a question. So also, for example, you can teach them how to ask question like, "Excuse me, can I have the toy, please?" So like that lah.
Like that, and also they can help to use a proper language, or sometimes maybe because nowadays a child can explore a lot of things tip of fingers, right? So sometimes maybe they do not know what is the proper language, what is the proper sign that they need to use, the proper voice tone. So it's important for them.
Or sometimes they can answer you something that is not related, like this is what I hear sometimes. How are you? I'm 8 years old.
Yes.
So they like misunderstand. So this is and then sometimes where I also seen this where the child say, "Tak nak." You ask anything, "Tak nak, tak nak, semua tak nak." So this is something that do you want this? No, no, no. And then when they request also cannot be in full sentences kan.
Yes.
So, okay, so through play you can show them what is the proper proper way of requesting. And then you can explore. Oh yeah, you mentioned that emotion. So
Yes.
when the child, like, we know that a lot of child nowadays find it difficult to share things. So I think from what you share is also quite important. So when when you, like, they want to share with you, they tak puas hati kan.
Yes.
The face is like angry, like why? So this is where I believe OT, or all of us can learn from OT in a way that we explain to them and then explore.
Yes.
And then one more thing also, exploration, explore their interests.
Correct. That's the important thing, because when we know that their interest, it's more easier for us to get their trust, to get along with them, like how we build a rapport with them. So it's more easier if we know the interest.
So the closer or rapport with them,
Yes.
the more things they can explore and more things they are willing to work
Yes,
with
correct.
you. Okay, so I thought I thought it's like, I buy you sweet, okay, then you listen to me. So
Cannot
it's
be
not
like that.
it's
Different
not
people have different interests, right? So,
so
like example, I give you a swing. Do you want to play with the swing? No, right? So you just like what you want to do. It seems like the kids lah. That's why we need to know what is their interest. Otherwise, they will be refuse or ignore you for the activities.
And then okay, and also I think it will teach them that whatever they want to play, it's not their way of playing. Like, they have to consider how others play, and what are the things, what else, or what are some of the things they can play. So this is all through role playing and any other types of playing, so they can learn sharing, okay,
and thinking and solving problems. So it's important for the child to play with that, especially with parents lah, because parents will spend a lot of time with their children, right? So that's why it's important for parents to expose and to to help their children in social activities.
Yeah. So also for parents and teachers, like what we have discussed just now, play doesn't mean we have to like make them like us. It's more of like rapport. Make them, we want them to feel comfortable when the rapport. So when we execute certain activities, they can come back to us, and instead of like just avoid or skip that, they can work together with the therapist. So it's not like, okay, you do the you let them choose, but also you can choose, give them choices, and also you can like play based on what you want. And then, like what Miss Alia said, it's easier. It's easier for us to find their interest and then work together.
Correct.
And then from there we can modify. So if those who are sending their child for OT, if you're not sure about play, I think you can ask the OT, like, how do you play with my child? Or you can see how the OT play with the kids. Because from this social interaction, I think they tackle a lot of things like concentration, attention. Like you said just now, eye contact.
So that's why I said that through play and also through the social, we can help tackle our children in cognitive performance, which is the eye contact, attention, following instruction, and so a lot of cognitive area we can tackle for them. And then we also can help to tackle for physical performance. Like example, when we do a board game, which is like a snake and ladder, like example snake and ladder. So they can know how to calculate with their fingers, so they will have a finger isolation, so they can use a fine motor skill to throw the dice and to play with the yang dia punya point tu. So that's why social actually is a big area. So OT will see in a small area.
So social interaction is small in OT development, but then from social interaction we can know what other things the affected, or what are the things that we can work together through play?
Correct.
So let's say, like you said, fine motor skill, gross motor skill, cognitive functioning. Wow, that's okay. This one I didn't know. I
That's
thought,
why
I thought play is like, you pergi main lah.
No, actually, for the OT part, usually what we do, sometimes parents or sometimes people don't understand why OT just give running. Actually, from the running activity, we can get the social play, we can get the cognitive play, we can get the gross motor, gross motor performance, and also can get the sensory part. So that's why in OT we look like we just apa ni, give parents to see outside, but for us we will see inside. So that's why it's more complex, and sometimes parents don't understand why we send our children to this, then they will be repeat with the same time. Actually, repeated of the activity can help the child more confident to perform.
Okay.
Because they don't know how to do.
I think, in my opinion, if I send my child for OT, I think I'm not happy with play. Now I understand, because for me, it's I think I can relate to parents as well. Like, well, I pay money and then
just play.
Play. I also can play
also
blocks
can
at
play.
home. But now, from sharing your point of view as an OT, now I understand. Through play, through social interaction, we tackle social skill, but also so many things inside the role play. Like, for example, you said role play or interactive play. Then not only responding, not only learn how to share on the social skill part, but also concentration, fine motor skill, when they take the block. Wow, okay, this is, wow.
It's a big area, right?
Now I'm clear why most of the time when OT introduce activity for younger children, especially especially children. Again, let's say I'm talking about 1 to 6 years old or 1 to 5 years old, because I think 7 years old and above will be different, right?
7 years old and above, usually we more focus on how they can perform academic, how they can be independent, because when they go older, they need to be independent.
Okay.
So that's why sometimes we just give like a complex play for them. More structured play for them now.
So now, in particular, we talk about 1 to 5 years old.
Yes.
Like what Miss Alia said, with special needs or without special needs or without disability, there's a stages, and this is how they introduce play, because that's one of the occupation. Now I'm clear why most of the time parents or teachers or any other health professionals other than doctor, where they suggest us, socialize. You can bring your child socialize, expose them to social group, like play group. For me,
yes, like a play.
Play. I thought sent to tuition is socialization. So now I have a clear understanding now. Okay.
Yes.
Now I can understand better.
Yep.
Okay. All right. So we are almost at the end of this Ask Charlie Anything session. So before we go, Miss Alia, any tips for parents to like play at home? Just now you shared quite a few role play, but any other types of play, like what activity, or because for me, if you say play, I just give the toys to the kid lah, and then let them play. I just sit there and look at them. So that's my understanding. So before we end, can you share us a bit about any tips or any suggestion for us to we can practice at home?
Yeah, actually we have a lot of activity. Like example, you tell me that you just give a toys, but you cannot just give a toy. You need to sit down with your children and play, because when you give a toy, they do not have any conversation. That's why parents need to give toy and sit with them and play with them. It's the most important for the child to develop their social skills, so they can have a social interaction, they can know how to perform a task and know what is the rules of the game. And also, other than this activity, parents also can provide board game, because board game we have a rules, We have sometimes of certain board game we have a timer so they can manage their time and also can have a conversation how to interact or how to perform the activity. Like example, we played what is it called? Monopoly, yeah. Like Monopoly activity, actually we have a lot of conversation. Like, I want to buy this. Who have this land? Who have the house? How much money? So that's why the board game also can help for the social skill for our
Development.
children.
Ah,
And also we can do turn taking games. Like example, the normal turn taking games we play. Like kalau orang Melayu dia akan panggil bola beracun atau kotak beracun, yang kotak jalan, then pick up and then answer or whatever. That's what turn taking games lah, macam tu.
like congkak,
Yeah, like congkak activity and sometimes
snack and ladder.
So that's one of the turn taking.
Apa? Uno card.
Yes, Uno card and so on. And then can also plan bring your children to play group so they can have a lot of interaction with other children, so they can develop more conversation with them. And other than that, you can teach how to recognize the emotion. So your children can know, oh, this is a happy face, or this is a sad face. Then they can express their emotion, express their feelings through their face recognition.
Okay. So, all right. So in general, we have to participate in the play lah. From what I hear, a lot is like we have to join in the play, participate and play together with them, not play along. Not I give you toy, you play, I sit here. No. So we have to join in play.
Yes.
And then in terms of play, we have different activity. Like you shared just now, is painting, tag turn game. So any kind of play, as long as we play together and also participate. Okay, and also you share about taking turns, responding, and the last one is recognizing emotion.
Emotion.
Okay, all right. So we are already at the end of the Ask Charlie Anything session. So please do follow our Facebook for more information for our upcoming talk or workshop. You can check us out. This week we have one more talk. Okay, and then also I would like to thank Miss Alia for spending the afternoon sharing with us about social interaction to play.
Yeah.
Okay, all right. Thank you so much, Alia. Thank you everyone for joining us today. See you in the next talk. Bye.
Bye.